South Africa is a country of many faces, and its healthcare sector, an interesting tapestry of challenges and opportunities, is no different. South Africa is the most diversified economy in Africa. It offers a combination of developed, first world economic infrastructure and a growing emerging market. Healthcare is provided through a highly unequal two-tier system divided along public and private sector lines. The quality of healthcare in the private sector, as well as certain academic hospitals, is of an extremely high standard. In fact, South Africa's major private healthcare groups are regarded as leading players in some international markets. South Africa's disease burden is markedly different to high-income countries, including the Netherlands. The South African government aims to reduce the country's burden of disease and increase life expectancy to at least 70 years of age by 2030. The pending implementation of a national health insurance will be a key dynamic in the South African market, and its introduction could create significant opportunities for companies which are able to scale up to meet the challenge of delivering on a national footprint. South Africa provides a lower-cost testing ground for the development of health technology solutions, because although complex and problematic in some areas, the regulatory environment in South Africa is less stringent than more developed economies.
There's definitely potential for investment of foreign countries into South Africa, as South Africa is very much still an emergent market and there's very remote areas, and that's again where we need partnership with different companies to ensure that there is connectivity, especially network connectivity. With the way that technology is changing, both doctors and patients, and I think even just the internet and having the access to knowledge has increased the demand that your end customer wants to see.
The market for health knowledge management is potentially very large. The benefits of electronic data capture and the pressing need to move away from paper-based systems have been acknowledged across both the public and private sectors. Growth in the telemedicine and virtual healthcare market is driven by the need for communication technologies, including a shortage of healthcare workers, especially in semi-urban and rural areas. Globally, AI and robotics are being used increasingly in the healthcare sector. In South Africa, owing to their significant cost, the majority of these technologies will primarily find a market in the private sector. At the same time, though, there may well be public sector interests in selected technologies, which either reduce costs or help to solve problems which are particularly acute in the public sector. If you're interested in being part of co-creating solutions to such challenges in the South African market, contact us and let's get the conversation going.